Chairman, we are ready to begin.
Denisha, if you conduct the roll call of board members, please.
Yes, Chairman. I'll begin with Roger Folsom,
Here.
Tommy Hopkins. Tommy Hopkins. I see that you're on. You may just need to unmute yourself. I'll come back to you. Cynthia Rucker,
Here.
Norman Boyd,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Shane Mobley,
Here.
Robert Coles,
Here.
Kathleen Ruth. Kathleen Ruth.
Dr. Ruth called me, Denisha. She's in Puerto Rico on a business assignment.
Thank you for that notice. And then I will call again, Tommy Hopkins. I'll let the record show that I do see that you are on the meeting, even though we can't hear you. Thank you, Chairman.
Well, a quorum having been established, we call the June meeting to order. Good morning, everyone, and happy summer. We are upon it. At this time, we'll have the approval of the minutes from the April 10th meeting. Dr. Tommy Hopkins, if you can hear me, if you have read those minutes and would move to record those, we would appreciate a motion. Well, Dr. Hopkins may be muted. Dr. Rucker, have you read those minutes and would you make a motion for approval?
I have read the minutes and I do make a motion for approval.
Thank you so much. Do we hear a second?
Dr. Cole, second.
Thank you. Have a motion and a second for approval of the minutes. Any additions or corrections? Hearing none, all those in favor of the motion signify by aye.
Aye.
Aye. All opposed, no. Motion carries. The minutes are approved. This morning earlier, the audit committee met and I'll ask Chairman David Cruz to give us a summary of that meeting. David?
Thank you, Mr. Chairman. We did have a meeting for about a half hour this morning, and we heard from Sonia Smith, who is Inspector General for the department, and from Joe Hood, who brought a good bit of commentary. But we heard reports on 2 CMS audits and then on 6 audits that are in various stages with the Department of Audits and Accounts of the state of Georgia. Several of those audits have been completed, and a couple of them are still in the process of department putting together responses to the audits. And presenting the reports to us, we were pleased to hear the progress on all of those audits. There was nothing that we felt that we needed to bring to the attention of the board in terms of anything that has not been addressed at this point. Overall, we had a very good meeting.
Your mama, anything y'all want to eat, y'all can take. George said that he's back in Mexico. In Mexico.
We had a good meeting and good report from the staff. That concludes my report, Mr. Chairman.
Thank you, David. Anyone have any questions for David? Okay, hearing none, we'll move on. We have a fairly busy agenda this morning. I would remind you, if you're not speaking, you may want to mute your phones or your device because we are getting some background feedback here. We do have a busy agenda this morning, and a couple of things we have a couple matters of business we have to attend to. But before we do that, I would like to have to notify all of you to put on your calendar October 9th. That is a scheduled board meeting for us, but we are tentatively planning an in-person meeting on October the 9th, and we'll host you down in Dublin. And if you can come in the evening before, I'll arrange some golf. If any of you are interested in that, we'll have a nice dinner, maybe some music, and then we'll have a good board meeting then on Thursday morning. And we may have a couple of guests. We might have a tour. We've been invited over to Fairview Park Hospital for some tour and information if we so desire. And so we're tentatively planning this. So I just wanted you to get October 9th on your calendar. It will be an in-person meeting. Some of us have never met in person with each other, and it'll be an opportunity to do so. Also, Dublin's fairly close to the coast, so if you're planning a weekend trip down to Savannah, Hilton Head, or to the Golden Isles, it'll be a good time to do that. And when we finish on Thursday morning, you could get out about noon or so and head down to the beach or to the coast. So we're looking forward to that in October and looking forward to being with all of you in person. We have about 10 items that we have to proceed with final adoption on this morning. So we have sort of a busy agenda. We have 2 items of business we have to conduct today, and per the bylaws, the board chair, vice chair, and secretary need to be elected and reelected each year. Each position term runs from July 1st through June the 30th of each year. As the board chairman, I have appointed a nominating committee for the board yearly election of officers. And that committee is as follows. Norm Boyd will be chairman. Dr. Kathleen Roof is a member, and Anthony Williamson is a member of this committee. And this committee will report recommendations back on the July the 10th meeting. And we will vote on the positions of chairman, vice chairman, and secretary at that time. And so if you have some input in any of that, you can certainly contact board chairman Norm Boyd. Per statute, the pharmacy board and dentistry board executive director's compensation package is approved by our board, the DCH board. So today we will vote on that compensation package for James Clint Joyner, who is the Georgia Board of Dentistry and Georgia Board of Pharmacy executive director. It's just a matter of formality for us to do this, and I would entertain a motion for approval and a second, please.
Norm Boyd, I move to approve.
Thank you. Norm Boyd has made a motion for approval. Do I hear a second?
Stan Mobley seconds.
Shane Mobley has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Motion carries. Thank you for that. That gets our housekeeping business in order. And I will call on Commissioner Russell Carlson for his report. Good morning, Commissioner.
All right. Thank you, Mr. Chairman, and members of the board and everyone watching at home. You're right. We do have a full agenda today, and I'll try to be brief. I just want to thank obviously the team. Much of what you see on the agenda today has a legislative nexus, things that came out of the session. And I appreciate the quick turnaround to get those towards implementation and execution, as we always work to meet the needs and the priorities of the legislature and the governor's office as they sign things into law. The last comment I'll make, though, Mr. Chairman, just obviously it's hard for us to convene and not at least mention some of the conversations in DC. It impacts the state, not only this agency and several others. And obviously Medicaid and healthcare in general are a big part of the discussions around this large spending bill. It recently, as you know, passed out of the House, U.S. House by one vote, and now rests with the Senate. But the proposed changes and the rumors of proposed changes are very much constant. And thanks to relationships on the Hill and at CMS, we've thus far been able to keep a relatively accurate, relatively real-time read on what's being discussed up there. But obviously none of us know how this is going to land. So as we've said multiple times in multiple settings, we're going to continue working with all our partners on staying current with the information, but we don't anticipate making robust changes to policy until we have an understanding of what final passage may look like. Things are changing day by day. with the White House weighing in, not to mention the House and the Senate. So we try to stay current on our information, but please know that as a department, thanks to our team and the stakeholders working with us, when it comes to alternative and contingencies and reaction to the various scenarios being proposed, we're not sitting idly by, and we're trying to keep all of our modeling and procedural work current. And so we'll be in a position to hopefully react one way or another to whatever passes in DC whenever something does pass. So thank you for everyone with your patience on that as we work through those big issues. And I do know we have a full agenda, but I do want to, if I may, Mr. Chairman, move to a couple, at least a few of the employee milestones we have some big years, and I hate to forego those. So if you can just indulge me just another minute, Mr. Chairman.
We always have time for that. That's
No,
important.
it's great. I appreciate it. So we're going to start out with a 30-year milestone, Thomas Sutton and HFRD. So appreciative. And now a series of 25-year milestones. Stephanie Annette Jones, Health Planning. Michelle Davis, HFRD. Ametria Baker, Financial Management. And Maya Carter with MAP, all at 25 years. And now for some 20-year milestones. Casey Diane Hooks Beasley with MAP. Cheryl Warren with HFRD. Some 15-year milestones. Brian Dowd with MAP. Marcus Clayton with IT, 15 years. Cynthia Fay, Health Planning, 15 years. With IT, we have Kyle Moody with 10 years. Jason Reeves with HFRD, 5 years, several 5 years here. Barbarielle Miller, IT, 5 years. Adepeju Odusanya, HFRD, 5 years. Kimberly Whitmore, 5 years. Treese Baker, 5 years with IG's office. Melanie Wilson with MAP, 5 years. Kayshawn Brown, Financial Management, 5 years. And now, as we like to do, we like to emphasize and celebrate our 1-year anniversaries. Thank you so much for joining the team. Akiroma Exumia, Financial Management, 1 year. Brittany Williams, Facilities and Support, 1 year. Brittany Steele, MAP, 1 year. Nehu Dave, Composite Board, 1 year. Tree Gwyn, Financial Management, 1 year. Air Umade Oso, IT, 1 year. Andrea Streeter, MAP, 1 year. Richard Jacobs, HFRD, 1 year. And Nadia Litback, HFRD, 1 year. Thank you to everyone for your commitment, whether it's 30 years or 1. We're very grateful for your contribution to the state and to the department, and for being a member of the family. And so thank you, Mr. Chairman, for giving me the minute. I know we have to get on to the Brian Dowd experience here. If you look at the agenda, you'll appreciate what I'm saying. So, Mr. Chairman, at this point, I'll hand it back to you. Thank you.
Any questions from board members for the commissioner? Well, Commissioner, that's quite a collective pool of wisdom and experience you went over there, and we're appreciative of each one of those employees. And as you said, we will move to the Brian Dowd show. We as board members are familiar with these items because we voted for initial adoption previously. And so these items will be familiar to us as we go down through the list. So the first item for consideration would be the increased reimbursement rates for autism spectrum disorder therapy. And Brian, who is our Deputy Executive Director of Policy, Compliance and Operations and Medical Assistant Plans, you're going to get quite a workout today. So we'll start with round 1.
Thank you, sir. Thanks, Mr. Chairman, Commissioner, and members of board. First item I am presenting for final adoption is an increase in reimbursement rates for the Autism Spectrum Disorder, or ASD, therapy program. Again, all of the items that I'm presenting today were introduced for initial adoption in the previous board meeting. So we do plan on, pending approval from Centers for Medicare and Medicaid Services and DCH board vote today, increasing the rates in ASD therapy by 3% effective July 1st, 2025. The 3% would be applied to all service codes offered in Medicaid and Peach Care for Kids under the ASD therapy category of service. An opportunity for public comment was held May 27th, 2025 at 10 a.m. via Zoom. Written comments were due on or before June 3rd. DCH received no oral or written comments. I will now pause for any questions and will request final adoption of the increase in reimbursement rates for ASD therapy.
Any questions from board members? O'Brien? Hearing none, is there a motion for final adoption?
Same modeling motions.
Have a motion. Do we have a second?
Second, David Cruz.
Have a second from David Cruz. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Motion carries. That item is approved. Brian, we'll move on to your second item, which is the increased reimbursement rate calculation for emergency air ambulance.
Thank you, sir. We are proposing to increase the reimbursement rate for emergency air ambulance pursuant to the budget bill and in the last legislative session. The department seeks to submit a Medicaid state plan amendment to the Centers for Medicare and Medicaid Service for approval effective July 1st, 2025. The change we are making is specifically to the loaded miles calculation in cost comparison for emergency air ambulance. We will be changing the loaded miles from a formula of loaded miles times $16 plus $2,573 to loaded miles times $21 plus $2,573. An opportunity for public comment was held on this change on May 27th, 2025 at 11 a.m. via Zoom. Written comments were due on or before June 3rd, 2025. DCH received no oral or written comments on the proposed change. I will now pause for any questions and will request final adoption of the increase in reimbursement rate for emergency air ambulance.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Norm Boyd so moves to final adoption.
Norm Board has moved for final adoption. Is there a second?
Dr. Rucker, second.
Dr. Rucker has made a second for that motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Motion carries. Thank you. We'll move on to the next item, which is rate methodology change, modify the reimbursement calculation for emergency ambulance public notice.
Thank you, sir. In accordance with the budget bill passed in the 2025 legislative session, we are seeking to modify our reimbursement methodology for emergency ambulance service. Currently in the emergency ambulance service policy, we disregard the first 10 miles of transportation. And we have included that in the base rate for emergency transportation. Excuse me. Effective July 1st, 2025, we are going to remove the calculation methodology requiring providers to disregard the initial 10 miles of transport and calculate miles from pickup to transportation endpoint. No modifications will be made to the base rate as part of this policy update. An opportunity for public comment was held on May 27th, 2025 at 3:30 p.m. via Zoom. Written comments were due on or before June 3rd, 2025. DCH received no oral comments, but we did receive 2 written comments. The written comments were for Colonel John T.Y. Smith, the COO and Senior Director of Operations with Gold Cross Emergency Medical Services, and John Hanson, the Senior Vice President of Emergency Medical Services at Grady Health Systems. Both commenters were in support of the proposed change. The commenters noted that the change will support sustainability of emergency services and is a more accurate and equitable reimbursement structure. The department thanks the commenters for their written comments and support. I will pause now for any questions and will request final adoption of the methodology change for emergency ambulance services.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Dr.
Motion
Cole,
for-
so move.
Dr. Coles has made a motion for final adoption. Is there a second?
Dr. Ruckers.
Dr. Rucker has seconded the motion. All those in favor of the motion signify by aye.
Aye.
All opposed, no. Motion carries. We'll move on to the next item, which is increase the existing payment for rural hospital newborn delivery program. Brian?
Thank you, sir. The 4th item I'm presenting for final adoption is an increase in the existing payment for rural hospital delivery program. We will make this change effective July 1st, 2025, pending the board approval today and CMS approval. This was part of the legislative budget from the previous year. What we are proposing is to increase the rates for add-on payments for rural hospital newborn deliveries from $1,000 as it currently stands to $3,000. Rural hospitals will continue to be designated as located within counties having populations of less than 35,000. An opportunity for public comment was held May 27th, 2025 at noon via Zoom. Written comments were due on or before June 3rd, 2025. DCH received no oral or written comments. I'll again pause now for any questions and will request final adoption of the increase in the existing payment for rural hospital newborn delivery program.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Norm
Same
Boyd.
nominal motions.
Norm Boyd has made a motion for final adoption. Is there a second?
This is Shane. I'll second.
Shane Mobley has seconded the motion. All those in favor of final adoption signify by aye.
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 Any opposed, no. Motion carries. We'll move to the next item, which is establish a new category for payment in the rural hospital newborn delivery program. Brian?
Thank you, sir. The 5th item I'm presenting today is where we are establishing a new category in the rural hospital delivery program effective July 1st, 2025, pending CMS and board approval today. The new category of payment will be for newborn deliveries in rural county hospitals with populations between 35,001 and 50,000 individuals. The department seeks to set the rural hospital newborn delivery add-on payment for this category of county hospitals or hospitals in these counties at $1,500 per delivery. An opportunity for public comment was held on May 27th, 2025 at 2:30 p.m. via Zoom. Comments were due on or before June 3rd, 2025. DCH received no oral or written comments. Again, I would be happy to take any questions and will request final adoption of the establishment of the new category of payment in the rural hospital delivery program.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Motion Williamson.
Anthony Williamson has made a motion for final adoption. Is there a second?
Second, David Cruz.
David Cruz has seconded the motion. All those in favor of final adoption signify by aye.
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 Any opposed, no. Motion carries. We'll move to the next item, which is an increased reimbursement rates for neonatologists and maternal fetal medicine specialists. Brian?
Thank you, sir. Effective July 1st, 2025, again pending CMS approval and the board's approval today, we are requesting to increase the reimbursement rate for neonatologists and maternal fetal medicine specialists. The increase amount is 8% and was outlined within the public notice, specifically with old rates and the new rates. An opportunity for public comment was held May 28th, 2025 at 9 a.m. via Zoom. And written comments were due on or before June 4th, 2025. DCH received no oral comments. We did receive one written comment. The written comment was from Nicola Chin, the president of the Georgia chapter of American Academy of Pediatrics. The commenter was in full support of the proposed change and expressed appreciation from the Georgia chapter of the American Academy of Pediatrics to the governor, the department, the board, and the leaders of General Assembly. The department thanks the commenter for their written comment and support. I will now pause for any questions and will request final adoption of the increase in reimbursement rate for neonatologists and maternal fetal medicine specialists.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Motion for final adoption, Dr. Rucker.
Dr. Rucker has made a motion for final adoption. Do we hear a second?
Norm Boyd, second.
Norm Boyd has seconded the motion. All those in favor of final adoption signify by aye.
Aye.
All opposed, no. Motion carries. We'll move to the next item, which is an increased reimbursement rates for select dental codes.
Thank you, sir. Effective July 1st, pursuant to the budget instructions in the 2025 legislative session and pending CMS and the board's approval, the Department of Community Health seeks to modify the state plan to provide an increase for specified codes for dental services. We did provide, there were a lot of codes. We did provide them in the public notice that is available publicly on our website. They will have the specific HCPCS codes and the rates outlined as part of that public notice. An opportunity for public comment was held on this change on May 28th, 2025 at 10 a.m. via Zoom. Written comments were due on or before June 4th, 2025. DCH received no oral or written comments. I will pause now for any questions and will request final adoption of the increase in reimbursement rates for select dental codes.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Motion for final adoption, David Cruz.
David Cruz has made a motion for final adoption. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded the motion. All those in favor of final adoption signify by aye.
Aye.
All opposed, no. Motion carries. We'll move to the next item, which is increase reimbursement rates for select primary care codes. Brian?
Thank you, sir. Effective July 1st, 2025, again in accordance with the legislative session and pending CMS and board approval, the Department of Community Health plans on updating the Medicaid state plan to provide an increase for two primary care codes. Those codes are 99213 and 99214. These are the codes for office or outpatient visit for low or moderate medical decision-making. We have, again, outlined the existing rates and the modified rates as part of our public notice that is available online. An opportunity for public comment on this change was held on May 28th, 2025 at 11 a.m. via Zoom. Written comments were due on or before June 4th, 2025. DCH received no oral comments and one written comment. The written comment was from Nicola Chin, president of the Georgia American Academy of Pediatrics. The commenter was in full support of the proposed change and expressed appreciation from the chapter to DCH, leaders of the General Assembly, and the governor's office. The department thanks the commenter for their written comments and support. I will now pause for any questions and request final adoption of the increase in reimbursement rates for select primary care codes.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Shane Mobley moves.
Shane Mobley has made a motion for final adoption. Do we hear a second?
Norm Boyd, second.
Have a second from Norm Boyd. All those in favor of final adoption signify by aye.
Aye.
All opposed, no. Motion carries. We move to the final one here. Rate increase for privately owned intermediate care facilities for individuals with intellectual disabilities. Brian?
Thank you, sir. The ninth and happily final item I am presenting for final adoption is a rate increase for privately owned intermediate care facilities for individuals with intellectual disabilities effective July 1st, 2025. This was part of the 2025 legislative session in the budget bill and does require Center for Medicaid and Medicare Services approval through a state plan submission. DCH seeks to modify the daily per diem rate for these facilities from $240.58 to $280.01. An opportunity for public comment was held on this change on May 28th, 2025 at noon via Zoom. Written comments were due on or before June 4th, 2025. DCH received no oral or written comments. I will now pause for any questions and will request final adoption of the increase in reimbursement rate for privately owned intermediate care facilities for individuals with intellectual disabilities. Thank you, sir.
Any questions for Brian? Hearing none, is there a motion for final adoption?
Dr. Coles, so move.
Dr. Coles has made a motion for final adoption. Is there a second?
Second, Williamson.
Anthony Williamson has seconded. All those in favor of final adoption signify by aye.
Aye.
All opposed, no. Motion carries. Brian, thank you for that yeoman's task of all that. I don't want it to appear that we've glossed over these issues. We know that each one of them are hugely important. And being this is final adoption, we have previously entertained information regarding these issues. So I want everyone listening or the public to be aware that we are not glossing over these issues. We recognize that. Thank you, board members, for your attentiveness and to each item. Thank you. Thank you, Brian.
Thank you, sir.
Move on to the agenda now to Carisha Lang, who is Executive Director of Office of Health Planning. And she's going to present some information to us on regulations for certificate of need.
Thank
Carisha,
you.
good morning.
Good morning, Chairman Folsom, Commissioner Carlson, members of the board. The Office of Health Planning presents today for final adoption the rules and regulations found at Chapter 111-2-2 Rules and Regulations for Health Planning Certificate of Need. A draft copy was provided to you. The proposed rule changes reflect amendments to the State Health Planning and Development Act, OCGA Sections 31-6-1 et sec, as a result of the passage of House Bill 1339 during the 2024 legislative session, which was signed by Governor Kemp on April 19, 2024. The proposed changes make updates to the health planning regulations so as to clarify certificate of need requirements and to clarify provisions relating to acceptance and review of applications. Additional revisions are proposed to correct grammar. A public comment hearing was held on April 8th, 2025 via Zoom. Written comments were due on or before May 23rd, 2025. No oral comments were received. The following written comments were received. Carrie F. Conley, Chief Health Policy Officer of the Georgia Hospital Association, which I will refer to as GHA. Monty Veazey, President CEO of the Georgia Alliance of Community Hospitals, referred to as GACH. And Jessica Holland, General Counsel of Resurgence Orthopedics, which I refer to as Resurgence. The following summary of comments was received. GHA expressed its general support of the proposed rule amendments. GACH expressed its general support of the proposed rule amendments and requested further clarification on the date used in the definition of threshold at proposed Rule 111-2-2-.01 A59B. Resurgence expressed its appreciation for the department's ongoing efforts to provide clarity and regulatory guidance concerning the CON program. Resurgence requested clarification regarding proposed Rule 111-2-.104A15, which indicates that the department will not issue a letter of determination to any party proposing to share operating rooms or common space between more than one group practice of the same specialty in a proposed ambulatory surgical facility. The department thanks GHA, GACH, and Resurgence for their written comments, general support, and feedback. Regarding GACH's comment, the date referenced in the definition of proposed Rule 111-2-2-.01 A59B was a typographical error and was corrected. Regarding Resurgence comment, proposed Rule 111-2-2-.104A15 clarifies that group practices cannot share operating rooms or common space, whether they are of the same surgical specialty or a different surgical specialty. Pursuant to OCGA Sections 31-6-2, 23, and 33, individual physicians who are not owners or employees of the single group practice of physicians that owns and operates a CON exempt ambulatory surgical center, ASC, may utilize that ASC as articulated in the statute and in proposed Rule 111-2-2-.104A1. The department is requesting approval of these rules for final adoption. If further clarification is needed regarding the proposed changes, I'm happy to provide that now.
Any questions for Carisha from board members?
It's Dr. Coles. I just wanted to clarify that basically, if you are not an owner, but you are of the same specialty, then you can operate in a differently owned ASC.
That's correct, Dr. Coles.
Thank you.
Any additional questions for Carisha? Fairly technical matter here, so if anyone has questions, now's the time to ask. Anything additionally, Carisha, before we vote?
No, that's it. Thank you.
Okay. Would a board member offer a motion for final adoption on this?
Motion for final adoption, Dr. Rucker.
Dr. Rucker has made a motion for final adoption. Do we have a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hear none, all those in favor of the motion signify by aye. All opposed, no. Anyone abstaining? Motion carries. We will move on the agenda. Carisha is going to give us an informational update on certificate of need. And so Carisha, if you want to do that at this time, thank you.
And thank you, Chairman. So I would like to provide an update on the department's convening technical advisory committees. Pursuant to OCGA 31-6-21A, the Georgia Department of Community Health is required to review and update the Certificate of Need State Health Plan every 5 years, beginning in 2025. The CON State Health Plan defines the need methodologies, standards, and rationale used to evaluate projects involving facilities and services requiring a CON. In accordance with OCGA Sections 31-6-21C and 50-4-4, the Commissioner may establish technical advisory committees in consultation with the board to inform effective strategy development and execution. For 2025, DCH is establishing technical advisory committees to review the CON rules for short-stay general hospital beds and perinatal services. Each committee will evaluate financial access, geographic availability of services, and other factors to recommend rule updates. Any proposed rule changes resulting from the recommendations of the committees will be brought before the board for review and approval. So I wanted to share with you today the members for each committee. So for the short stay general hospital beds technical advisory committee, we have Dawn Benson with Phoebe Health System, Linda Berger with Northeast Georgia Health System, Chet Basin with the Board of Healthcare Workforce, Dr. Ed Grimsley with Mercer University School of Medicine, Shelley Harrell, Memorial Health University Medical Center, Bill Lee from Evans Memorial Hospital, Christine McEwen with Piedmont Healthcare, Robin Rao, Miller County Hospital, Dr. Teresa Rohr Kirkgarber with AU-UGA Partnership. We thank all of those members for participating in the short stay general hospital bed technical advisory committee. For the perinatal services technical advisory committee, we have Julie Ballantyne from Northside Hospital, Mike Banna with Children's Healthcare of Atlanta, Dr. Keisha Collins with Mercer University School of Medicine, Darcy Craven with Archbold Medical Center, Caitlin Kopp with the Department of Public Health, David Levitt with Levitt Healthcare Affiliates, Dr. Chadburn Ray with the Medical College of Georgia, Dr. Lalitha Sivaswamy with Atrium Health Navicent Medical Center, Jason Stevens with Wellstar MCG, LaDon Toole with Memorial Hospital and Manor, and lastly, Dr. Maddie Fiesel-Wolf with Emory University School of Medicine. We thank these members also for their willingness to participate in the Perinatal Services Technical Advisory Committee. The inaugural meetings of the committees will be held this summer. And lastly, may it please the board and commissioner, I would like to formally introduce our newest team member, Ms. Rebecca Goldman. Rebecca will be the primary liaison with the technical advisory committees, and she will be able to provide updates regarding their work. So thank you, Rebecca. I just wanted to make sure you all were formally introduced to Rebecca, as you will see her more often.
Thank you. Happy to assist.
Thank you, Chairman. That concludes my update.
Welcome, Rebecca, to the team. And Carisha, if you have a minute, any board members have any further questions for Carisha? If not, thank you for that information.
Thank you.
Well, we've covered quite a bit.
Chairman, I think you accidentally muted yourself.
You got me now, Tanisha?
Yes, Chairman.
Okay, thank you. As I was saying, we covered quite a bit of ground this morning in a relatively short amount of time. So I want to really thank again all the board members for your attention to detail and the flow of all this morning, and thank
Thank you, Mr. Chairman. Appreciate it.
Thank you.
Thank you.